Remember the old days when all you had to care about were your keys and your cell phone while leaving home? For me, now there's one more reason to take the painstaking trip from the lobby back to my apartment. Face mask. The COVID-19 pandemic accompanied lots of new things, new ideas, and concepts we were not familiar with before. For instance, did you ever know your local grocery stores could run out of toilet paper? Or all of a sudden, you would feel an urge to go back to your workplace, to shake hands, or to not shake hands. I never knew this will add to my decision fatigue. Who knew the customary handshake will be replaced by an elbow bump? Call it my ignorance of the world trends, I didn't even know elbow bump was a thing. The pandemic has affected almost every sector, every industry. It was expected that it would impact the healthcare sector and the political sphere. But I was quite fascinated to see how the fashion industry is also catching up. It was when I first saw the Louis Vuitton face shield and Burberry mask. We also came across some terms or words that most of us had never heard before. For instance, in his famous speech at the peak of coronavirus outbreak, the Director General of the World Health Organization said, "We're not just fighting a pandemic, we're fighting an infodemic." Infodemic is a blend of two words, information and epidemic. In other words, the rapid spread of sheer volume of information, including the misinformation and the fake news about this pandemic. Sunlight protects against coronavirus. Masks cause suffocation. Malaria drugs cure COVID-19 are all some examples of misleading claims with no evidence base till now. Recently, Saiful Islam and colleagues published a social media analysis in the American Journal of Tropical Medicine and Hygiene. They found more than 2,300 reports from 87 countries that incorporated rumors, stigmas, and conspiracy theories related to COVID-19 in just first quarter of this year. It is not a surprise that social media is widely seen as the main culprit of this rise of manipulated and misleading information because of the limited scrutiny. So people look forward to the news outlets to get a clear picture. Intrigued by the news media's role in navigating infodemic, I evaluated the news reports that covered a research study regarding the BCG vaccine, which is also commonly known as the tuberculosis vaccine. This study linked the country's BCG vaccination policy to protection against COVID-19. It is published on a preprint server, which means that it has not undergone scientific scrutiny or peer review. The study has some limitations, and based on its design, it can serve to generate some association, but not causality. This is something the authors of the study also clearly mentioned in their manuscript. To further explain the difference between an association and causality, I'll present an example here. An analysis found an association between a country's chocolate consumption and its number of Nobel Prize winners. In the figure, you can see that Switzerland has a high chocolate per capita intake and a high number of Nobel laureates per 10 million people. While on the other extreme, countries like China and Brazil have a low chocolate intake and fewer Nobel laureates per 10 million people. What's the problem with this kind of data? Well, the issue is that countries don't eat chocolates. People do. And countries don't win Nobel Prizes. People do. Although countries with higher chocolate consumption per capita have more Nobel laureates per 10 million population, it does not mean that all people who eat chocolate win a Nobel Prize. Back to news media. I found out that there are more than 100 news reports that have covered that BCG COVID-19 research that I just talked about. Many exaggerating the study's results, and some even comparing this vaccine to a silver bullet against COVID-19. Here, an important point to consider is that BCG vaccine is mandatory in numerous countries around the globe. Therefore, over-exaggeration of the study results and the unwarranted hype can potentially instill a false sense of security in a big portion of world population. What's more alarming is that even some scientific journals were a source of misinformation, although unintentionally. There have been some scientific retractions during this pandemic due to low credibility information or forged results. For instance, a biomedical journal article linked 5G technology to coronavirus induction in skin cells. That article was later retracted. From all this, one thing is clear. Almost no information platform is free from misinformation. However, it does not mean that we do not believe in any piece of information around us. I believe most scientific journals publish credible evidence. And many news outlets are doing excellent work by publishing accurate and well-argued content about COVID-19. And to clarify, I'm a proponent of freedom of expression and news media. I merely want to emphasize the need to be more cautious during these turbulent times, and especially when people's lives are at stake. The burning question is, what can we do to hinder the spread of misinformation and its behavioral consequences? Researchers have observed that simply providing people with correct information does not necessarily override their false beliefs. Think about it for a second. What happens if someone challenges your belief system or worldview? For some, it is like tearing away a part of their identity. So today, I'm going to talk about 3 concepts that can help us better navigate misinformation and promote positive behaviors during this pandemic. The first such concept is social contagion. Or in simpler words, it's people's tendency to think or act like their peers. It suggests that behaviors and ideas are contagious or catchy. They can spread from one person to another in much the same way as a viral illness or infection. We are influenced by the people around us, and our actions are partly derived from what others approve or disapprove of. Generally speaking, when you meet someone, if they smile, you smile. Or when you're a part of an audience, when everyone around you starts clapping, you start clapping. Researchers have long studied this phenomenon and its link to health-related habits. For example, a study demonstrated that a workplace smoking ban on workers also decreased the likelihood of smoking among their spouses. And a number of studies suggest that even obesity can be socially contagious. For instance, in a fascinating study, a University of Southern California researcher, Ashlisha Dattar, and her colleague observed the military families assigned to installations in different counties. They found that families that moved to counties with higher obesity prevalence were more likely to be overweight or obese, and vice versa. Moving on. The second concept I would like to talk about is the illusory truth effect. It suggests we tend to believe in a statement if we are repeatedly exposed to it. To put it another way, you repeat something enough times and people start believing it. This is something frequently practiced by politicians and marketing professionals. What if I tell you that the tallest mountain on Mars is half the height of Mount Everest? And then you also hear it from a bunch of your friends and maybe see some posts on social media about it as well. Wouldn't you start believing it? Of course, if you're well-versed in this subject area, this might not be the case. But what if you're not? Researchers also found that, interestingly, prior knowledge about a subject or ideas does not necessarily save you from the trap of illusory truth effect. Dr. Lisa Fazio, an assistant professor of psychology and human development at Vanderbilt University, studies this phenomenon. And in one of her research studies, participants who knew that kilts are the skirts Scottish men wear became doubtful if they were exposed to the statement, "A sari is the short pleated skirt worn by men in Scotland." And they became even more doubtful if they read this statement again. Recently, Doctors Julie Bernard and Paul Hunter from the University of East Anglia tried to model how misinformation spreads. Their model suggests if you tip the balance from bad information to good information in the correct proportion, you can have a significant effect on people's behavior. It means we can positively change people's behavior by flooding information media with verified, good COVID-19 content. This strategy can submerge misinformation. Lastly, I would like to talk about the importance of how we frame a message. The way information is presented to us has an influence on our behaviors. The same information presented in a different way can make people take different decisions. Suppose you go to a supermarket to buy a hand sanitizer. You're presented with two options. Let's call them sanitizer A and sanitizer B. There is no difference between these two sanitizers except one. Sanitizer A claims to kill 99% of germs, while the sanitizer B mentions that only 1% of germs survive after using it. Both of these statements convey the same message but are framed differently. One talks about killing the germs, while the other one talks about survival of germs. You might not of germs surviving and eventually end up buying the sanitizer A. A very important point to consider while framing a message is that our minds do not only process the precise statistics, but also the simple bottom line meaning of a statement, which we call gist. And this gist, in turn, helps derive our behavior and beliefs. In the US, Dr. David Broniatowski and colleagues collected more than 4,000 news articles about vaccines during the Disneyland measles outbreak of 2014. They studied each article's likelihood to be shared on Facebook. They found that articles that contained gist were shared more often compared to those that only contained verbatim statistics. A coherent story with a gist is easier to comprehend and recall, and possibly more persuasive. What's next? We can use these concepts to our strength, not only to responsibly combat the tidal wave of misinformation, but also by reflecting upon them to see if we are the victims. Through social contagion, we can infect people to responsibly follow the preventive measures, and through our understanding of framing and illusory truth effects, we can flood the information media with the verified, coherent, and justful COVID-19 content. In present times, we need to rethink how we consume information. We have to be more skeptical about the information shared with us. And here I would also like to stress that even people we trust can unintentionally disseminate wrong information. Maybe because they themselves are misinformed. Therefore, do your own research. Avoid using social media as a source of coronavirus information. Rely on sources that promote evidence-based science and publish verified, informed, and in-depth news reports. Look for articles written by science experts. And more importantly, make sure that you only spread the news from authentic sources. I would particularly like to mention two authoritative sources for coronavirus information. One is the World Health Organization, and the other is the Center for Disease Control and Prevention in the United States. Their websites feature up-to-date and evidence-informed content. This pandemic and the infodemic that accompanies it is our common enemy. Let's stand together to hinder the spread of misinformation in these turbulent times. Remember, it's not only about our future, but also the future of our families, friends, and loved ones. Thank you very much for listening, and stay safe.